Welcome to Shri Medical College. Today we will explore physiotherapy for seniors, maintaining mobility and independence. Since many elderly suffer from many conditions, providing care for them requires a wide range of knowledge and experience. Conditions affecting the muscles, heart, and brain are particularly prevalent in the senior population. There could be some overlap between these groups because so many persons over the age of 65 have multiple health issues. Physiotherapists that work with the elderly should specialize on musculoskeletal, neurological, and cardiovascular disorders due to age-related changes in health and illness presentation. A physiotherapist who specializes in geriatric care should have a strong understanding of all three areas, with an emphasis on how they may best serve the elderly. Physical therapy, whether in the form of sessions or treatments, is essential for a full and rapid recovery because it aids in the restoration of strength, mobility, and flexibility. The capacity to bend and lift, along with strength and equilibrium, declines with age. Consequently, physical fitness is a challenge for the elderly. Physical therapy helps the elderly keep their independence by improving functionality, reducing discomfort, and increasing strength and balance. For the vast majority of people, illness or injury, not old age, is the cause of disability. Although the body's systems become less efficient with age, anyone can maintain peak performance so long as they put in the effort. By enhancing the performance of a number of physical systems, physiotherapists play a significant role in assisting the elderly in regaining mobility and independence. When improvement or preservation of functional mobility is not a feasible goal, physical therapists can nonetheless help the elderly remain pain-free and comfortable. Preventative health measures through health promotion. National guidelines should be followed when providing treatment and conducting assessments on the elderly. The evaluation of the elderly must take into account the physiological changes that occur with age. The World Health Organization's (WHO's) International Classification of Functioning, Disability, and Health (ICF) is the most complete and widely applicable model of rehabilitation. Assessment, goal setting, and treatment planning for people with disabilities are guided by a paradigm called the International Classification of Functioning, Disability, and Health (ICF). Strengthen yourself by the leading cause of physical therapy for the elderly is injury from falls. When elderly people are involved in accidents, even minor ones, they often suffer fractures and other serious injuries. They may be weak and dizzy from exhaustion following a protracted hospitalization. As such, it's possible that physiotherapy within the framework of elderly care could be effective for maintaining muscle strength. In older patients who are able to move around, physiotherapists can teach them techniques for staying steady on their feet. Seniors will be better able to protect themselves with this knowledge. The elderly might learn to lessen the discomfort caused by conditions like arthritis and osteoarthritis. It could also be used by the elderly to prevent the onset of potential symptoms. Physiotherapists focus primarily on the patient's physical complaints and deficits. Therapeutic interventions should focus initially on improving the older patient's ability to do activities of daily living. The effectiveness of any treatment plan must be measured against pre- and post-intervention assessments of functional tasks including getting in and out of bed or a chair and navigating the home. A physiotherapist can identify underlying limitations influencing performance after witnessing an elderly person do a task like a chair transfer. Challenges can be of the physical or mental variety, such as a lack of strength or coordination or an irrational fear of falling. Physiotherapists use few procedures that differ from those taught for all age groups, whether it's manual treatments in a clinic environment or functional intervention in a person's home. Physical activity has many health benefits and should be encouraged for everyone, but the elderly, especially those with heart disease, osteoporosis, or another chronic illness, have unique hazards. Physiotherapy is a safe and effective way for seniors to exercise with the guidance of trained specialists, minimizing the risk of activity-related ailments. It may take more time to learn and practice the skills necessary for some therapy modalities. Even with an acute sprain, the technique for taking a patient's history is the same, but therapy will consider the patient's whole medical history and condition before the accident. Although rest, ice, compression, and elevation, rise, should be utilized initially, the therapist must first determine whether or not ice or compression may cause more damage to the skin. Patients can be effectively treated with physical therapy without resorting to medicines or invasive procedures. Improved muscular fitness and flexibility can aid in the diagnosis, management, and prevention of a wide range of medical issues, and thus prevent the invasive treatments they may require. Due to the increased dangers of surgery with advancing age, it is essential that the elderly refrain from having operations whenever possible. Keep in mind that over-the-counter pain relievers can sometimes nullify the benefits of prescribed medication for chronic diseases. A reduction in drug use should be a major objective of any health and wellness initiative. Sometimes, surgery is the best option for helping an elderly person with health problems. Primarily, preoperative physiotherapy works to ensure that the patient is in good physical health before the surgery. Physical therapy following surgery is especially helpful for the elderly. Exercise raises the success of approaching surgery by maintaining and enhancing your loved one's cardiovascular circulation and capabilities. Meanwhile, your elderly loved one can benefit greatly from physical therapy after surgery to help build strength and speed up the healing process. Most elderly people take medication for pain relief. In any case, the best physiotherapist can help the elderly cut back on or even stop taking these costly drugs altogether. There are more and more people who need help from others due to age, illness, or other difficulties. Physical therapy helps the elderly because it reduces pain and helps them move again. Simple mental health exercises may have a significant impact on the lives of seniors. If your loved one wants to maintain good mental and physical health, you should urge them to participate in physical therapy exercises. Anxiety and stress in the elderly can be alleviated by the endorphins released during physiotherapy. Increases in intelligence and self-assurance are two positive outcomes. Physiotherapy is beneficial for anyone who wants to improve their physical and mental health, not simply athletes and people in rehabilitation. Your parents or grandparents can look forward to a long, healthy, and happy retirement thanks to the physiotherapy exercises they practice. Join Shri Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.